morning, everyone. It's a pleasant privilege to be in Warangal because when I came back from England 20 years back, 2003, I think it was the first time Warangal people, Sir is here, Sir is here. He called us and gave me the privilege of doing a live surgery. And one anatomy professor of ours also I operated her, and that opened the gate for my practice. Thank you so much, sir. I officially acknowledge your contribution. And I think today I'm much more happy and proud because you have seen my son doing that. What else you need for a father to see his son doing well? And of course, people all know that Adarsh has scored already. I'm not going to give some more insights into that about the orthopedics. So basically, the introduction is that there have been significant improvements in various aspects of orthopedics. The improvements are implant design, material science, and polyethylene cross-linking, ceramics, and uncemented. The biggest advancements have been the role of technology. And now the patient-specific instrumentation have come, customized implants have come, the sensors have come, accelerometers are there. But of all these, despite advances, the 20% dissatisfied totally patients are still there. Till today, nobody knows why the 20% are unhappy. But of course, this is a Western literature. Even in the Indian patient, my feeling is, I'm sure as shared by all orthopedic surgeons of India, our dissatisfaction rate may not be as high as 20%. I'm sure Sunil and others doing orthopedics will agree. Because our people demands are not that high. Because the Western population, the first thing they come and ask is, when can I have the sex? When can I play with golf? So those things are different compared to our patients. So our dissatisfaction rate might be less. In fact, we are doing one paper on that. So the solution is obviously the technology, the robotics. And of course, it took me 5 years to marry the robotics. And of course, after seeing so many advances, and after going to Australia and America in one trip, it has opened our eyes after seeing those surgeons doing knees and hips 35 to 40 minutes flat, and with such an accuracy. So that's where we were sold to that, and with our numbers we thought we will do it. And the other point is that robotics cannot go wrong, because still today in the history of the whole technology and science, wherever the robotics have gone, whether it is supply chain, whether it is industrialized, whether it is other parts of automotive industry, robotics always revolutionized and brought the things there. So then we went and bought the robot, and people asked, there are so many robots, why you bought a striker robot? Because it was in fact the costliest robot. But we wanted to have a better robot, which is a real robot, which can add to the science rather than to the marketing. No doubt it will have an halo effect and it will add to the marketing, but I was fortunate enough not to go into that marketing only because I had enough decent practice by that time. So we went and saw the papers, international centers who are doing the robots, we visited them. Another thing which sold Mako to us is the ability to do the hip replacement, because there is no other robot in the present context which can do hip replacement. And second one is, this has got a haptic control. I already explained to you, the haptic control is a haptic technology generated by the robot, where it creates boundaries and you cannot cut beyond boundaries. So even if your saw goes out, the saw will not work. So that is where the haptic boundaries work. And in fact, time and again, it has prevented us doing obnoxious surgeries in that. The next one. So advantage of Mako, this already we have done that, and 10 years of Mako data is there, so we wanted to have the best of the things. So we have taken that. This already workflow has been explained by others partially, but basically the best part of the robot is, unlike navigation, you need not cut until you are satisfied. So plan, replan, 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 then only cut. So the last thing is cut. So there is no more adjustment there. And second thing is the advantage is, service, I have to go home. Right, I know that I am the last speaker. The second advantage of the robot is it will be able to give you a kinematic alignment or functional alignment, which is the new buzzword in the last 5-6 years. And the youngsters, you all know that the knee replacement was given by Insol with a mechanical alignment. That means the articular structure or the femorotibial articulation is absolutely perpendicular to the mechanical axis and parallel to the ground. But our normal anatomy is not like that. Subramanian, all these people who have studied the posterolateral corners and all that, there is a slope of the joint, and that is violated in mechanical alignment. But in those days when Insol was there, 50-60 years back, there was no enough technology to deviate from the mechanical alignment. That was the easiest to do that. But now the latest thing is each person's anatomy is different. So functional anatomy is the way to go. And one of the hypotheses is that so-called 20% unhappy knees are because we are violating the normal anatomy. So there is one thing called kinematic alignment and then restricted kinematic alignment. There are so many new concepts that have come. Kinematic alignment is basically an alignment which will add a bit of varus to the joint, which is the normal. So in fact, we are all born with varus. You see any Indian knees, we are all born with varus. And that varus, normal anatomy, if you are restored, then that will add to the functional outcome. That is one of the theories. So there is no way you can do non-robotically kinematic alignment. Because you don't know how much you cut the varus, how much you are going to put the slope, whether you can put the varus and valgus in the femur. All these things come into play. That is where the robotic. Now there is another thing is called personalized arthroplasty. That means each person is different. We take the anatomy of you, we build the slope, we build the varus, and then we'll go ahead with this one. So these are all dynamic joint balancing, and as I said, that is how the robot shows you. The green one is the implant, and you can see this one, the numbers in the bottom. By just moving the diameters, you can see that. I'll just show you here. The CT scan alignment is also very good, and you can see that by changing your varus, valgus, or even external rotation of the femur, you can completely make it to the next line. So that is what it is. So basically now, in the olden days, Insal told knee replacement is nothing but a soft tissue procedure with bone cuts interspersed. Now that is 180 degrees opposite. Now it is only bone cuts with the minimal ligament release. We don't do ligament release at all in robotic knee replacement, and even gross deformities. I will show you some examples. And you can see here, even gross deformities with minimal joint balancing, we can do the gap balancing by just playing with, before cutting the implant, by moving up and down, by moving varus and valgus, by rotating the femur into external rotation or interrotation. Haptic technology, I already explained to you. And so basically, the advantages of the haptics is it will preserve the periarticular soft tissue envelope. All the arthroscopic surgeons will be delighted to know this concept. There is one thing called milieu interior of the knee joint, which we have been violating in knee replacements left, right, and center. We replace dissect the collateral ligament, we go to the posterior part of the knee, we dislocate the joint front, and we external rotate, we release whatever the tissue comes in the way. That's not the way to do a knee replacement now. So the violation is now gone out of the window, and we preserve the soft tissue around the knee as a sanctum sanctorum. So that is where it comes, and of course, so this is auto stop, which we already shown that, and precise bone cuts, minimal soft tissue penetration, and all these solve problems. Another thing with the robot is there is no more a mid-flexion instability, which is a problem with the manual knee replacement, because the robot tells exactly the gaps and exactly the balancing, and you don't need to worry about mid-flexion instability at all. In our almost 3,000 knees so far, we have not had a single mid-flexion instability of the knee. So all these things can be addressed by the robot, and success rates are wonderful, not only for the surgeon, but for the patients. As Adesh told, what does it mean to our patients? Another thing is, which in our thing we do almost, let's say, 20-25 per day. The second day when I go to surgical ICU, 10 of them are non-robotic, 10 of them are robotic. Without even seeing the notes, without seeing the X-ray, I can know who is the robotic, who is the non-robotic, just by their facial language. Because the robotic patients, the 24 hours post-operative pain is so less compared to other ones. We don't know why exactly, but some of the theories are coming because of the less inflammatory markers. Because we are not dissecting the knee at all. We are not dislocating the knee at all. We are not releasing the tissues at all. Already, Haddad from London, he has done the study of the inflammatory markers. I think that makes all the sense. And 3 months recovery also is phenomenal with robotics. Manual people keep on complaining of hamstring pain, the anterior knee pain, and they say that knee is heavy and all that. Robotics, you don't feel that way. And of course, as I told already, this is the trip which we opened our eyes, and then we went into that and then embraced that, and our experience is phenomenal. It is not to tell all the youngsters and the senior surgeons robotic is the only way. No. but it's one of the best ways if we can afford it. It runs into crores of rupees if we can afford it. But I'm telling you, with the advances, with the more people getting into the fold, in another 10 years, robot will become like a sea arm. There is no second thought about it. It will become like a sea arm. Of course, we had proctors, Radhars, Kushal, Suhas and Pracha. They go all over India now to teach the other surgeons, including therapy workshops. So we now got the international endorsement of a center of excellence, and this is the future: robotics, artificial intelligence, and machine learning.
Hospital, no company is there between. Doctor is not there. Patient is paying in dollars to the company.
To the Raghuveer, sir. I request Mahidar. Dr. Krishna Subramaniam, sir. I request Dr. Ram Mohan to present a shawl to Adarsh Annapareddy. Another young orthopedic surgeon, like Guruvareddy sir, we wish him all the very best. I request Dr. Kali Prasad sir to present a shawl and a certificate to Dr. Guruvareddy sir. Now I request Dr. Srinivas Reddy sir to come on the dais. Dr. Mahinder. And Dr. Ram Mohan. Thank you, sir.
Start with quiz session for postgraduates. Quiz master Dr. N. Now I request Dr. N. Srinivas Reddy sir, quiz master, and resource persons Dr. D. Maheshwar sir and Dr. Karthik Reddy sir to come on to the dais. From Gandhi Medical College, Team C from Osmania Medical College, and Team B from Nizam's Institute of Medical Sciences.
Welcome to you all for the Quiz 2022 finals, and congratulations to all the participants who have come for the preliminary quiz debut a couple of days back, and 9 teams have come in, And out of that, we have conducted a preliminary quiz, the written quiz. In that, 4 teams were selected, and congratulations to all the 4 teams who fared well. And I wish you all the best for the participants. And the rules will be, I will tell the rules, how to answer everything. Okay, all the 8 people have come. And we'll start. Are you ready? Ready? Okay, then. Yeah, this is the layout. And Team A consisted of 2 postgraduates. One is Vinender and another is Ajit Rampure from Government Medical College, Nizamabad. Right, and Team B consisting of Balraju and G. Raghavendra from Gandhi Medical College, Hyderabad. And Team C, Dr. K. Hani and Dr. Srinivas from Usmania Medical College. And Team D consisted of Safia Sultana and Dr. T. Sandeep Kumar from Nizam, Hyderabad. Okay, I wish you all the best. And this is the layout, how the questions and how to answer, what are the rounds, everything is here. And totally we are having 60 questions. I will tell you, you can't see back. There are 60 questions, okay, and each question 1 mark, okay, and each team equal opportunities. Everyone will get 15 questions, okay. No discrepancy in that, equal opportunities to win, and we are having 4 rounds, okay, like that. And the first round is pass-on round. Pass-on round. I will pose a question to Team A. If they answer, it's well and good. If they don't answer, it goes to Team B. And if they don't answer, Team C, like that, up to Team B. Okay. If first team answers, Team A answers, and the next question will be Team B. Okay, like that. The next question will be to the other team, the coming team. Okay, like that. And if for the first team, first question team, and next question you have to answer immediately. It won't be. We don't give any time to the team B. First, understood? First question is put to Team A. They will be given 20 seconds. And Team B, we don't give any time. You should be immediately prepared for the answer. No time for that. Okay? That is one. And second is direct round. Direct round means how many? There are 4 questions will be to each team. 4 questions direct. It is not a pass-on. It is only exclusive for you only. Okay? For that also 20 seconds will be given. And again, in that 16 questions, team direct round. Second round 16 questions, first round 16 questions, and third round is again pass-on round. Okay? And third round again the same, similar to the first round. Third round pass-on round is similar to the first round. And the final round is the 4th round, is a rapid fire round. It's almost instantly you have to answer. Couple of seconds will be given to you, and it's no time. That's it. Okay? And it will be finished in 1 minute. Okay? Each team 3 questions in 1 minute. Okay? Right. 12 questions in the last round. All put together 60 questions. Okay? Okay. And some of the anything you can ask me right now. Clear? All the 4 teams? Clear. And first, some of the instructions. Keep all your mobile phones in silent mode. And one most important thing is 2 members are there in each team. And only 1 person should be the spokesman. 1. You select who want to answer. You can discuss, but spokesman is 1. Only 1 person should express. If 2 people means there will be confusion because one will say one answer, another will say another answer. To decide between you. Okay? There are certain questions where there are 2 for A and B in the single question. If you answer partly, it's only half mark. Okay? Like that. And unanswered question. Okay, unanswered questions by all the teams will go to the audience. Okay, and more one request to all the audience not to interrupt the quiz, and every answer is thoroughly checked. We are having ample evidence for each and every question and answer. Okay, and the decision of the quiz master is final. Okay, and are you ready? Be cool. The first round is, I didn't tell you, it's only a mark round. It's a mock round. Okay. No marks will be given to you in that mock round. Okay? Right? Start?
Yes.
Okay. In the TV later. No, no. Change angle change. The main round will continue. Start. There is a flexor pollicis longus. Okay. Whatever. Mic లేదు. Separate mics కావాలి.
పాసాన్
మైక్స్ కావాలి, ఇంకా రెండు కావాలి.
పాసాన్
ఒకటి కాదు, ఒకటి. One. The question will be team A. No, whatever. Mic unna lekuna answer you can tell. Huh? It's audible. Okay, clear? Ready, team A. Okay. This is the pass on round. What is the angle subtended between these two lines? Team A. 20 seconds.
6 degrees.
It's okay. Actually, one numerical is allowed. It's 7 degrees. In fact, it's a one mark to team A. It's 7 degrees. In fact, the difference of one numerical is only allowed. No, it's over. It's a mark to team A. It's allowed. What I want to say is allowed. It says 7 degrees. They told 6. It is accepted. Team B. While performing TKR, knees gradually flexed and tibia is externally rotated till it is dislocated anteriorly to expose the posterior border of the medial plateau. Name the maneuver. You can have a video also. After the video, let's start the timer. Name the maneuver. Pass, huh? Okay. Team C. Pass. Team D.
Salesman.
It's okay. It's a true, clear. It's a be clear. Still, because if it is half answer, you'll get half mark.
Salesman.
It's not insults maneuver. It's runabout plus insult half. Ransal's maneuver. You'll get half. Okay. Right. It is next to team C. Karthik. Team C. Next to. Please remember. Score person should remember which team. The question is put to team C. Yeah, that you have to remember. Score people, they have to remember. Next question will go to team C. Be ready. Name the fracture. It's a very important fracture in adolescent age group, just before epiphyseal closure. It's a significant fracture actually. Name the fracture. Everything is clear. Both X-ray picture and also the diagrammatic. Team C. No, there is a name given to that. Oh, next team B.
Chopard.
If you know, tell. Otherwise, there is no time for you.
Chopard.
No. Goes to A. Audience. Sudhir, Dr. Sudhir, great. Yeah, everything is clear. Very nicely depicted in the line diagrams. Yeah.
What is your technique?
Yeah, exactly. That's a Matizzi technique. It's a technique where we pass in children, actually this described. Radial neck fractures. Right, okay. 1 mark. Okay. Next team. Question to team A. Okay, right. Be ready. Again, one. See the video. What is the gait? Concentrate on the gait. Child. Everyone should concentrate. The question is for all, you think, because if they don't answer, it will come to you. Identify the gait.
Intoing.
Exactly. Intoing gait. Answer. 1 mark. Next, team B. Okay? Team B. Team B, be ready. During distal femur plating, plate is placed anterior to this line, and during retrograde femoral nailing, entry is placed anterior to this line. What is this line named as? Yes, Blumenstadt line. That's the answer. Okay? Right. 1 mark. Next question number 7 will come, and that is to team C. Be ready. You concentrate. This is a young patient with left lower limb poliomyelitis, PPRP, post-polio residual paralysis. You see that, and you see the right side also, the same person after surgery. After surgery. See? You want to play again? Again play? Right. You see both concentrate. Left is preoperative, left this side, left, the right side is post-operative, polio patient. The gait has altered. Okay, got the point. The question is different. Name the gait, name the surgery. Two parts are there. That is correct. Next, name the surgery. Which has made him to abolish the hand to knee gait. Name the surgery which brought the change, significant change. No. Half mark.
Quadriceps.
No. Come this way. Yeah. Ask, if it is not, it will go directly. No. That's a very famous surgery because the polio patients have come down. That's a supracondylar extension osteotomy. Audience. Audience. Okay. Right. Okay. Okay. That's it's almost after. That's an animation video. You see how the changes. That before surgery, after surgery, how the change has come. You see the animation. Right? Okay, question, sorry, actually. Half is told. Okay, next is person D, no? Team D. Okay, team D, name the angle. Very important to maintain, even for every surgery it is important. Every means, maybe you may go for HTO or you may go for TKR. That should not be like that.
Medial proximal tibial. Medial.
It should be parallel actually. The line should be parallel. What do you call that line?
Geologic virus.
No. Not. Next. Again, audience, huh? Pass. C. Audience, no. It's your choice. Huh? No. Huh? Yes. Joint line convergence angle. That's the truth. Akansha Sinha is a quiz runner in 2020. Great, congrats. Next question to team A. Sir, please remember because you have to remember. Karthik, concentrate. Mail kuda student, you see. You know, it's for you. A na? Team A.
Biceps.
Huh?
Biceps tendon.
Which one? Biceps tendon, which tendon? Oh, there are two tendons. Yes, long head. Long head is the correct answer. Team A. Okay, long head is the correct answer. Now team B. Team B, be prepared for the next question. That is 10th question. Read it and I will also read. Name the line drawn from the center of intercondylar notch to the deepest point of the trochlear groove to access femoral component rotation while performing TKR. Name the anteroposterior lines shown between points K and R. Time pass to team. Yeah. Pass. Huh? Pass D. Huh? Yeah, done. It's a time ఉండదు.
Not clear.
With huh? No. A little bit because the wording is okay, but it's different.
Audience.
White side. Audience. No. Audience, na? Next. It's over. The viewers is over.
White side line.
White side line. It's a. No. Whitman's line. Next, people. Audience. Check it out. Answer. Dr. Akhil. Congrats. Okay. Next. Team C. Is okay, no? Because you do remember. Because sometimes we don't know. Be clear. After that, nothing we can do. Huh? Team C. Question 11 to team C. Name the surgery. That's a forearm. I am giving you a clue. Yes, Krukenberg's amputation. Krukenberg's amputation. Right. Next to team D. Okay? Clear? That is answer, of course. 11. Krukenberg's amputation. Team, name the fracture. You know everything. I need not explain. It's a very...
Sex loperus.
Yeah, that is true. Essex low press steel fracture. It's a very well described fracture. Team A. Team A, right. Team A, be ready. 13th question, this answer, Essex low press steel. Okay. 13th question. Name the, it's a well described and a very difficult fracture, difficult to operate. Results are also guarded. Name the coronal shear, name of the fracture, what I am asking. Coronal, the fracture is very clear in the X-ray. Coronal shear fracture of capitellum with large osseous capitellar fragment. Name of the fracture, just like Gallagher fracture, like that, there is a name given to this. Over now. Yes. Next, team B. B. Pass. Team C. Team C. Pass.
What is Mason fragment?
No.
Audience.
Audience.
Hans-Steenthal fracture.
Hans-Steenthal fracture is the right answer. Sridhar Reddy. Yeah. Right. The winner of runners of quiz 2020. Right. Hans-Steenthal fracture. That is. Okay. Next, you have to answer. Question 14 to Team B. Name the nerve affected.
Median nerve.
You are right, full marks, but if you tell,
And
you still more.
anterior introsus.
Yes, exactly. Perfect. Perfect. Mark, 1 mark. Team C, right? Team C. Next 15th question is for Team C. Be ready. Identify the pathology. It's a unit. Left side, left side. X-ray is also given. Very clear.
Congenital knee dislocation.
Exactly. Perfect answer. Congenital dislocation of knee. Answer. Ipudu, next. Team D. Ready? Team D ready? Next question. Of course, the answer will come, but next, be ready. It's a video, it seems. It's a video. Concentrate on the video. Name of this surgery. That's the name of this surgery. It's a famous surgery. You see. Yeah, you have to know. Next.
Plus.
Postgraduate, you have to know that. It is in here. Okay? Audience, you can.
Rotation plastic.
Rotation, who told? Which one? Which one? Premchand. Which one? Name, who told that? Name, perfect.
Thermoplastic.
Okay, you got it. You told, but I know. Here. Srikam. Sushrut. Okay, Sushrut, Dr. Sushrut. ఒకసారి మ్యూట్ వస్తుంది ఆడియో వస్తలేదు డాక్టర్ సుశ్రుత్ I think this is yes, Warner's rotationplasty, a famous surgery, is done in tumors. Very good functional. It looks quite different, aesthetically different, but functionally very good. Ankle becomes knee, like functions. In functions, ankle will be like a knee, and they do well. And end of first round sports. Okay, right. Score Stefan.
They have completed successfully the first round. At the end of the first round, the scores are like this. Team A got 4 marks, Team B 2 marks, Team C 2.5 marks, and Team D 1.5 marks.
Okay, right. Okay, right. Next question. Direct round. Team A, be prepared. Okay. Team A. All questions to Team A. 4 questions. While performing primary TKR, if you find flexion space is smaller than extension space, what is the next step to equalize the gap? Tell properly. Tell, you have to answer. One answer. Time is over. If the time is over, you can go to. Yeah, that is the right answer. Okay, next, be prepared for the next. Okay, right? Seagon fracture is pathognomonic sign for which ligament injury?
MCLT.
Wrong answer, it's the ACL. Okay, next, be ready. Which of the following regions of spinal cord is a watershed zone? It's not. C answer. Wrong. Mark question. Okay. Next 20, question number 20. Right, the surgeon has done primary nailing for tibia fracture with intact fibula. In order to achieve compression at the fracture site, surgeon performed osteotomy fibula. Post-operatively, he noticed great toe drop. Ankle dorsiflexion, plantar flexion remain normal. Remaining toes are normal. What would be the most likely cause of great toe drop? You read. You can read it. The time is started. B. Yeah, that's it. B for Bombay. Okay, that is the right answer. Okay, next, Team B, be ready. Team B, okay? This is a question. Pseudotumors containing alval are associated with the following bearing surface in THR. Answer it.
Option B, ceramic and polyethylene.
No. The audience time but okay. Because they are asking. Okay. Next 22. Okay. Next question. Team B. The football player fell on his flexed knee with foot in plantar flexion. On examination, quadriceps active test is positive. Which knee ligament is most likely injured in this patient? Answer. Tell.
Option B, PCL. PCL.
PCL. Yeah, right answer. PCL. PCL is the right answer. 22. 23rd question. The weakest part of annulus fibrosis is?
Posteromedial. Option C.
Postro?
Medial. Option C.
Posterior wrong answer. Posterolateral. Next question. A patient who previously underwent tibial bone transport and recovered well, now he sustained closed displaced tibial fracture and fibula fracture immediately below the consolidated region, right? Now, which of the following fixation methods cannot be done?
Option C, nailing.
Yes, answer is no, because that is the reason. Okay, over, no? Yeah. Next, be ready, team C. Question 25. You are performing cruciate retaining TKR during trials. You find that your tibial tray is lifting anteriorly, open book effect, and you come to interference. The PCL is tight, flexion space is tighter than extension space. What is the next best step to increase flexion space?
Option B.
Option B is the wrong answer. Option C. Okay. Next B, ready? 26th question. Image shown, clinical sign is which condition? Tell.
So biceps test.
Yes, that is the right answer. Okay. Biceps tear. Next one. Cauda equina syndrome is caused by. Very clear, no? Answer is so easy.
4 and 5.
Yes, that is the right answer. 4 and 5. Next one. Very clinically oriented question. You are asked to supervise the tension band wiring case for transverse medial major or fracture done by your junior colleague. He asks you the direction of the screw to be passed in tension. What is your advice? There are 3 options you see. One is straight, one is inferior, one is superior. Direction of the screw doesn't matter.
Straight, sir.
No, should be inferior. Go inferiorly, screw operate directly inferiorly, avoid screw pull out. Team D. Ready? A patient underwent TKR 6 months ago. His post-operative events are uneventful. Now he complains pop-up and palpable clunk as knee extends from 40-degree flexion. On evaluation, his joint is stable and radiographs are normal. What would be the most likely implant in performing? See the video and tell. Next. Come on. Answer. Option.
There's a question.
Next question.
Yes.
Option. Okay.
Should retaining.
Cruciate. No. What do you say?
A.
Yeah, the right answer. That is the right answer. Okay. Right. Next question. Double PCL sign is seen in which conditions?
Can I bucket handle tear of meniscus?
Yes, that is the right answer. Right. Okay. Next, we ready with the next question. longest ligament of the spine is?
Ligamentum flavum.
Yes, that is the right answer. Okay. Right. Next. Okay. ఇప్పుడు team D కదా? Team? Huh?
One more question is
I'm not running team D కదా? అదే అడుగుతున్నా. One more question is there, but the Ponseti method of clubfoot cast treatment starts with which of the following steps? Very important. Very clinically.
selection of first try.
3 option?
3.
3, that's exact. Right. Dorsiflexion of the first try is the right answer. Next. Nice. Karthik.
Marks.
Huh?
At the end of second round, Team A got 6 points, 6 marks, and Team B 4 points. Team C 4.5 marks. Team D 4.5. C
Okay.
and D both are 4.5. B is 4. A is leading with 6. Thank you.
Pasan round. Be ready. First team A. Okay. Karthik, team A. Yeah. Yeah. What is the abnormality seen in the pediatric hand diagram drawn by an orthopedic postgraduate in examination? There is some error. Gross error. Done. Over. Huh?
Carpal bones.
No. Team B. Just point out where there is an error. B, kada? B, tell it's move. Over. Team C. Team C, because you have to tell instantly. Team C.
The articulating surface of both radius and ulnar at same level.
No. That is not. Only the red ones you see. Team D.
The MCP joint.
Huh?
MCP joint.
Where?
First
What?
MCP.
First MCP what?
It is articulated with PC form. But it should not.
No. Audience can? Epiphysis. Where? What? Yes. Venkat, congratulations. You see the diagram next? You see the answer? You see, that is the right side, but you see the left one, where the epiphysis is. Epiphysis is proximal. Thumb bit is proximal. Growth plate is not disturbed. Okay? Next one. Team B, ready. Identify the mechanism of injury. All clinical oriented questions. Time is up.
Supination and external rotation.
No. Next.
Supination adduction.
Yes, that is the answer. Supination adduction. Next, team C. Team C, be ready. Name the short external rotator, very clinical oriented. For operative, you have to know. Short external rotators in the order from above downwards.
Piriformis, superior gemella,
Yes.
operator internus, inferior gemella.
Yeah, exact correct. That is the answer. Next, team D. Identify the implant. Old implant. Old.
Single blade plate.
Huh?
Angle blade.
Yes, truth. 90-degree angle blade, correct answer. Right, next. He may be ready. Okay. 37th question. Mute item. Mute. Volume rather. Flexion on evaluation is joint is stable and radiographs are normal. What would be the most likely implant in performing? See the video and tell. Next. Come on. Answer. Huh? Option.
There's a question.
Next question.
Yes.
Option. Okay.
Shed retaining.
Associate. No. What do you say?
Yeah.
Yeah, not the right answer. That is the right answer. Okay. Right. Next question. Double PCL sign is seen in which conditions?
Bucket handle tear of meniscus.
Yes, that is the right answer. Right. Okay. Next, be ready with the next question. The strongest ligament of the spine is?
Ligamentum flavum.
Yes, that is the right answer. Okay. Right. Next. Okay. ఇప్పుడు టీమ్ డి కదా టీమ్
One more question is
అన్నో రన్నింగ్ టీమ్ డి కదా అదే అడుగుతున్నా one more question is there, but the Ponseti method of clubfoot cast treatment starts with which of the following steps? Very important. Very clinical.
selection of first try.
3 option?
3.
3, that's exact. Right. Dorsiflexion of the first try is the right answer. Next. Nice. Karthik. Huh?
At the end of second round, Team A got 6 points, 6 marks, and Team B 4 points, Team C 4.5, 4.5 marks, Team D 4.5. C
Okay.
and D both are 4.5. B is 4, A is leading with 6. Thank you.
Hassan round. Be ready. First team A. Okay. Karthik, team A. Yeah. Yeah. What is the abnormality seen in the pediatric hand diagram drawn by an orthopedic postgraduate in examination? There is some error. Gross error. Yeah, over. Huh?
Carpal
Next.
bones.
No. Team B. Just point out where there is an error. B, kada? Next. B, tell it's move. Over. Team C. Team C, because you have to tell instantly. Team C.
The articulating surface of both radius and ulnar at same level.
No. That is not. Only the red ones you see. D.
The MCP joint.
Huh?
MCP joint.
Where?
First
What?
MCP.
First MCP what?
It is articulated with PC form. But it should not.
No. Audience can? Epiphysis. Where? What?
You should need space.
Yes. Congratulations. You see the diagram next? You see the answer? You see, that is the right side, but you see the left one, where the epiphysis is. Epiphysis is proximal. Thumb it is proximal. Growth plate is not distal. Okay? Next one. Team B, ready? Identify the mechanism of injury. All clinical oriented questions. Time is up.
Supination and external rotation.
No. Next.
Supination adduction.
Yes, that is the answer. Destination adduction. Next, team C. Team C, be ready. Name the short external rotator, very clinical oriented. For operative, you have to know. Short external rotators in the order from above downwards.
Pyriformis, superior gemella, operator internus, inferior gemella.
Yeah, exact correct. That is the answer. Next, team D. Identify the implant. Old implant. Old.
Angle blade plate.
Huh?
Angle blade plate.
Yes, truth. 90-degree angle blade plate, correct answer. Right, next. Team A, be ready. Okay. 37th question. Mute again. Mute. Volume rather. Just one question like that. To have it because you are the person who made everything, because that's why we have given importance in the subject. Next.
End of the third round.
Scores.
The scores are like this. Team A comprising of Nizamabad gets 8 marks. Team B comprising of Gandhi Medical College 5 marks. Team C comprising of Usmania 10.5 marks. And Team D which means 8.5 marks.
Okay, everyone is having ample choice.
Right.
Equally, because this is the last round, rapid fire round. You have to answer. Okay, meaning you don't give him much time. Huh? Question to Team A, be ready. Okay, they are a little bit easier questions actually. Bridge plate works on the principle of absolute stability or direct bone healing. True or false?
False.
That is true. Mark 1. Bridge plate works by relative stability and indirect bone healing. Okay. Next. Commonest muscle affected in forearm compartment syndrome. Fast.
FDS.
FDS. Wrong answer. FDS. Wrong answer. No. Nothing like that. Next one. Next. Be ready. Thurston Holland sign is indicative of. Type to right answer. Bas. It's over. Yours is over. 3 questions. Team B, ready? Ready? Function nail works by the principle of elastic impingement. This is a type 2, correct. Correct. You asked, you can go back, but you can't go forward. You can go back. And team B? Team B ready? Functional works by the principle of elastic impingement.
False.
That is a true answer. No marks. Wrong answer is wrong. Most common cause of facial damage leading to growth arrest is?
Infection.
Yes, that is the right answer. Next. Yeah, trauma. It says, please, trauma. I'm sorry, really. Trauma, it's don't give marks. Okay. Okay, right. Trauma is the right answer, of course. Trauma is the right answer. Okay. Next one, is it clear now? Be ready. Beheaded Scotch Terrier sign is seen. Very easy. Over, nothing. So you have to tell instantly, easy questions. Pass, okay? Clear?
Spondylolisthesis.
Huh?
Spondylolisthesis.
Yes, right answer. Yes. You are given more time actually. Okay, team C, be ready. Team C. If fibrous intozone is more than 8 mm in bone transport, the rate of distraction should be reduced. True or false?
False.
Answer is true. Wrong answer. Name the nerve supply of gluteus medius.
Superior gluteus.
Right. Okay, next 57th is going to be ending. For the treatment of recurrent patellar dislocation, the procedure semitendinosus and vastus medialis advancement was described by?
Emsley Trillet. Emsley Trillet.
No. Geology. Over. Yours is over. Your last. Team D. Name the fracture. You have to tell the easiest one, no? Easiest and the simplest one. Over. Next. This is so easy answer. In fracture lateral condyle humerus in children, the size of the lateral condyle peroperative is smaller than what we see on X-ray. True or false? Very clinical application is having. True or false? Just only two options.
It's true.
It's how you say true? It's a false. Huh? In fact, it is bigger than what we see on X-ray because of large cartilaginous element. Okay. Next one. Last, the over the external fixator in comminuted intra-articular fractures works by the principle of. It's over. The quiz is over. If there is a tie, again it starts. Over. It's a ligament ataxis. End of fourth round is final round. Of course. Winners, runners. We finished actually 72 minutes.
At the end of the fourth round, at the completion of quiz,
This is over.
Yes.
This is over. Fourth round is over.
Now all the teams stand up there. Now team A from Nizamabad, they got 10 marks. And team B from Gandhi Medical College got 6 marks. And team C from Usmania got 11.5 marks. And team D from LIMS got 8.5 marks. Here the winner, successful from the Team C, Usmania Medical College. Congrats to you. Second place is Nizamabad. And the third place is NIMS. Then last place is a Down.
Last question, I will give you one more prize. Rakesh, you want to ask one question?
Zero. Patukara.
Announce the cash prize.
Announce the cash prize.
5,000 first prize, 2,500 second runner up. Winner.
First prize.
Congratulations.
Second.
Second, winning.
Vice season highway.
Congratulations.
Congratulations to all the teams. All the teams, all the participants. All the participants. They did well.
Runner up from the Nizamabad. Nizamabad team A.
Right, thank you all the participants and also the scorers. Dr. Maheshwar as the resource persons, and they did well. Thank you.
Who identified my name?
Just a second.
Prasad sir to come on the dais. TOSA Secretary and TOSA President-elect of 2022, Dr. Vijay Bhaskar sir. TOSA President-elect Dr. GVS Murthy sir. TOSA Secretary-elect Dr. Srinivas Kasha sir. Organizing Chairman Dr. J. Venkateshwarlu sir. Organizing Secretary Dr. V. Rakesh sir. Organizing Treasurer Dr. Sirish Kumar sir. Now, the dais. We also request Dr. Vijay Bhaskar sir to accompany sir. TOSA President-elect Dr. GVS Murthy, sir. I request, sir, to honor TOSA Secretary-elect Dr. Srinivas Kasa, sir. Organizing Secretary Dr. V. Rakesh, sir. Organizing Treasurer Dr. Sirish Kumar, sir. Now we request TOSA Secretary Dr. Vijay Bhaskar, sir, to say a few words.
Now I request Dr. Good afternoon, everyone. I immensely thank each and everyone of this fraternity who has made my journey to the President of Telangana Orthopedic Surgeons Association, and the conference was a grand success with the theme of what not to do, and it is even I learned a lot from this, what not to do in different surgeries. And I congratulate the whole team of OSA and AMC, orthopedic surgeons, for their good, fantastic arrangements and hospitality to the guests and everyone, and thank everyone.
Thank you, sir. Now may I request Chairman, sir, Organizing Chair, give his remarks.
Dignitaries on the dais, dignitaries of the dais. Good afternoon, everyone. I'm very happy that the whole conference went on well, and only few hours left. And I'm thankful to all my team members, all organizing committee chairmen, co-chairmen, all others and all my postgraduate students, everyone who arranged and put in their efforts in making this conference grand success. I thank all the those office bearers who spared their time and valuable time, and all the delegates who attended this conference. Thank you, one and all. Thank you.
Now may I request Dr. Rakesh, organizing secretary, to give his remarks.
Foremost, I thank Dr. Prasad sir, Dr. Vijay Bhaskar Bhaiya, Dr. Murthy sir, and his team of TOSA executive for giving Warangal this opportunity. Fittingly, we had our organizing chairman at JV sir, who was so passionate about this program that he allowed us and has given a free freedom for all of us to do all the activities which we wanted. I was ably supported by my treasurer in this function, Dr. Sirish. Despite his schedule at MGM, he used to be there with me for the last 1 month, more or less. We both had dinners together. And his wife refused to give him a dinner the day he missed me on one of the events. So that was something like that. So with all support I got, both from income end as well as from expenditure end. And that first part was ably helped by none other than Sudhir Bhaiya. He needs a big applause. He has really supported in greatly contributing to it. Second man who has done that is our OSA President Kali Prasad sir. He has been generous enough, open enough to give his function hall for the 2 events without anything. He just said, I'm giving. So I'm very thankful to you, sir. Ram Kumar Reddy sir, Srinivas Reddy sir, Rajesh, Maheshwar Bhaiya, Kranti Bhaiya. These are all the people who did all the homework to get the scientific program intact. So I am deeply indebted to all of them. And similarly, for the food section, again Sudhir Bhaiya and Mahendra, they were instrumental in trying to organize both the inaugural dinner and banquet dinner. And I am greatly thankful to both of them. Apart from all this, my teacher Raghuram sir, all the department of orthopedics and the 3 professors, JV sir himself, Lakshmanaran sir, Ram Kumar sir, his associates, assistants, and all the postgraduates. They were really with me to do all the activities so that I didn't have to really do a lot of work. And here I have to mention few postgraduate students who were there with me all the time. First applause goes to Eldos. He has really been with me. Next is Vignesh, Vivek, Prem. Where is he? Outstanding. Prem, he is Prem. So like this, and Vaishali, since last 5 days, she has done so many rehearsals with her team of 5 that we could get this program into good shape. I am also indebted to good sponsors from our own Rohini hospitals, Dr. Gurva Reddy at Sunshine Hospitals, and many more who have contributed a good share for our souvenir. The souvenir has been done, most part was done by Sirish himself along with Krantena, and they could get in a very short time the souvenir which we released. Here it would be unfair on me not to say a word on the contributions that were given to me by Principal Kakatiya Medical College, Dr. Mohandas sir, Superintendent of MGM, Dr. V. Chandrasekhar sir, apart from our Health University Vice Chancellor Karnakar Reddy sir, Rector T.V. Rao sir, and Registrar Dr. Praveen. So I am again thankful to all of them. Apart from that, all the members of OSA, whenever I have called, depending upon the committees in which they were in, they all responded positively. And here again, another special thanks I have to give to one more person is Shravan and Sagar. They really did a very good work to coordinate the transport of all the people and their accommodation. I am thankful to you all. Then lastly, I have to thank my staff who have been there with me all through. then the staff at this podium and this hall, NRI hall, Kaushik, they really were instrumental in trying to get the best out of it. They have really changed all the lighting system. The coordination of the NRI Trust was immense, and I thank all of them for that. Last but not the least, the beige up front was borne by Sudhir Bhaiya and my wife. They took good this thing despite my this thing. I thank all of them. And lastly, the faculty, which was guided by a team of people. I applaud Gopinath for that. I applaud Surya Prakash sir for that in the spine sector. And in hand, Gopinath was there. Then Srinath was there in Onco section. Srinivas Reddy sir needs a special mention. He could see that he could get 7 out of the major faculties from different parts of India. Then the IOE, Atul Srivatsa sir firstly, because he guided me as to whom I have to contact in this proceedings, and thanks to Naveen Thakkar sir. R. Selvaraj sir, when I was treasurer of OASIS, I was very close to him. So on my immediate request, he has booked his tickets a month back. I should thank him too. Unfortunately, Anil Kutti sir and Ramesh Sain sir could not come because of a preceding fixtures of theirs. So with these few things, I take this opportunity to thank all the people once again. Thank you very much.
Thank you. Thank you, Rakesh bhai. Dr. Sridhar Reddy has been awarded gold medal quiz in 5th. Again, Dr. Akanksha Sinha for gold medal in quiz 2000. Now, Dr. M. Srikanth. I call upon Dr. C.H. Sushruth. Important session is changing of the medallion. May I request Dr. Raja Ramesh, the next team, and you just come onto the dais. Joint Secretary, President. Ramesh. Handing over my responsibilities to a new secretary, Dr. Srinivas Kasha. The flag. Now the treasurer responsibility to.
More than 13 lakhs. 35 lakhs. 35 lakhs.
Now from Dr. Ramesh to Dr. Raja Ramesh. You have to shake hand with him. Hand over it. Thanks, bhai. Once he has given the bag, I will speak from there.
So, first let us give a big round of applause to all the Warangal team. We have to get the opportunity. We have conducted the conference very nicely, sir. We are very, very happy. And dignitaries from the dais, President, Secretary, and all my crew, whatever it is. And dear friends and members. My respects to elders, greetings to friends, and best wishes to youngsters. And hope I want to work in brief. And I thank everyone for bestowing the responsibility of being president of our vibrant association. I think ours is young but very vibrant association. What I should do as a president is already written in Constitution. I have to just implement it. It is very well enshrined in the Constitution. And only little bit changes have to be done because of changing times. We are facing Corona and so many other things. With the changing times, we have to change it a little bit. So that is the reason why I thought with everything written there, we have to set things right. So my agenda is set things right. STR. STR. That's what I felt, that's what I can do. With not alone, with my team of executive and with all your support. That is very, very essential. What I feel, my team should be able to communicate and be available to every member on a phone call, to interact, to take their opinions. I think Kasha is well versed with all these things. He will help. Our rank with team is there, they will also do. That's what I feel. And just past president, sir, our association is a continuous process. It is not a change year after year. It is a continuous process. When I do something, Vijay will take over. So that is how things will continue. So hope with all your directions we will go in a right direction. Of course, the main goals of our association are already written. That is, first thing is academics and spreading orthopedic knowledge in the society. Because there are so many misconceptions and they blame us for these misconceptions. So it is our duty to educate them what is right, what is wrong. And of course we can, as far as possible, we can educate the legislation also. So voluntary bodies, government organizations, everywhere we should try to do our job. That's what we are trying to do. So that is what is in my mind. And so let me conclude with respect to elders and affection to my colleagues and generous towards my juniors. That's what we say. Thank you. Jai Hind. Rakesh wants to announce that. No, this is regarding this, today's.
Unbiased judgment regarding the papers and posters has been done with the respective judges in that program. This year, gold medal paper for PG goes to Dr. Sakir. Then gold medal paper for consultant goes to Dr. Gopinath Bandari.
Yes, please come to dais. We are not able to see.
Saket, come here. I request President Dr. G.V.S. Murthy sir to give a bouquet to Saket. Check. Next, Gopinath Bandari sir, in the consultant category. Request him to receive a bouquet from our president. The gold medals of these two categories will be presented in the next year conference. Then quiz has already been announced. Then regarding poster, I request Dr. Maheshwar sir to say a few words. The winner of this gold medal poster is Vamanagiri Ramu Yadav from Kamineni Institute of Medical Sciences. Is he inside?
The posters are very good.
Very good.
Problem is?
Yes. Certain poster pictures are poor and text is small, and the literature which is allotted 20% of the mark, they are not mentioned in their papers. So you, before presenting the e-poster, you please know about how many marks are allotted to each and every part. In that, most of the papers are very good, really, but they have not come to up to the, not got the good marks just because of the lack of the literature and references that we want to take. Then the most of among the
we have gone through all the poster presentations. Most of the poster presentations were very good, and I really congratulate every PG who has put a lot of effort in making such posters. They were really good, elegant, but most of the posters were missing the references, which makes us, that has made a difference as it carries 20% of marks. And finally, after going through all the posters, we have concluded a paper by
Vamanagiri Ramu Yadav. This is for the mucormycosis because it is one of the rare and sometimes it's a fungal infection in the period of COVID season also. So that's a good presentation there, and also got all the criteria it's fulfilled with like references and everything. So
it was a case of an unusual case of mucormycosis in compound grade 3A tibial plafond with medial malleolar fracture by Dr. Vamanagiri Ramu Yadav. I congratulate him and I wish him all the success.
Thank you. The notice
Congrats.
Thank you.
Thank you, sir. Now,
Two members to whom he wants to give some mementos.
First of all, I thank sir for giving me this opportunity to conduct the workshop, and it was successfully organized, and we had 40 delegates who have attended the conference, and they were divided into 20 teams, and all the 20 teams had 40 delegates, PGs who have got a hands-on dental repair workshop, and out of them they were judged by Professor Anil Bhatt, who is the head of hand unit in Manipal, and he has announced, first of all we wanted to give one award, but he said three teams deserved, and the three teams we wanted to give an award now. So I want to announce the winners, and I request President Murthy sir to give the award and certificate. For team 1, Balraju and Raghu. Balraju and Raghu. Akhil, yeah. Balraju and Akhil. Balraju, Dr. Balraju. Yeah, one of them. Raghu. Next, Nitin also, and there also. Gautami and Nitin are here. Next, Gautami and Nitin. Nitin is here.
To ask our organizing chairman, Dr. GV sir, to felicitate the outgoing president of TOSA, Dr. Prasad sir. Secretary of TOSA and incoming President-elect of TOSA, Dr. Vijay Bhaskar sir, is a dynamic young leader with a vision, and we hope he will take the organization to a greater heights. The outgoing treasurer. Thank you. Now, I request JV sir to present a shawl and a memento to outgoing joint secretary, our own brother Ramesh Bhaiya, and coming as incoming treasurer, hope he will improve the organization accounts.
I'm happy that he is my student.
Now I request last time organizing secretary Dr. Timareddy sir, for me, he was always guiding me on phone.
Thanks to me, we have 4 lakhs rupees.
President TOSA, Dr. Murthy sir, and past President Dr. Prasad sir to present him a shawl and a memento.
Actually, we three were in one unit. Under Dr. V.S. Reddy sir in 1989, I think. 1989.
I request our VOSA president, Kali Prasad sir, who was instrumental in this whole of the program. He inspired us from 2018 when we vowed for this event at Nizamabad. Since then, he has been inspirational for us. Sir and GVS Murthy sir too.
Good afternoon, dignitaries on the dais and off the dais. As organizing president, myself, Dr. Sirish Kumar, present vote of thanks and thank all the faculty members, chairperson, delegates, senior professionals, especially Dr. Raghuram sir, who came a week in advance for our prestigious event, TOSACON 2020. I thank all the organizing committee members, staff and colleagues of mine for the success of the event who worked day and night. I thank the sponsors, Dr. Guruvareddy sir, Sunshine Hospital, Hyderabad, Dr. Kranti Rao sir, Triveni Hospital, Hanamkonda, and especially Dr. Kali Prasad sir for providing the function hall for our inaugural backyard. I thank all the pharma companies who supported and surgical agencies and print and electronic media for their support. I conclude and request all to join for the match. Thank you.
Raise for the Janaganamana.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मा